Dr. Beau, my son is experiencing knee pain. He's 13 years old and he is getting back to activity. What is going on? All right, let's dive into it. Let's talk a little bit about the knee today. That's right. We are going to be talking about the actual knee joint and the three most common causes of things that I see all the time with my younger athletes. So just to do a little quick anatomy review with you, when we look at the knee, first off, how do we tell which way the knee sits? There are a few different bones. So the bone on top is called your femur. The bone that goes right down the middle is called your tibia. And the bone on this outside here, this little guy right here, is called your fibula. Now, all three of the most common knee pain injuries actually have almost the exact same treatment protocol. So pay attention. The number one most common thing that we see with younger athletes is a condition called Osgood-Schlatter's disease. I know, big name, very simplistic understanding. What ends up happening is simply this. As our body continues to grow, especially with our younger male athletes, as they enter into puberty, what we see is that the bones are continuing to expand and to grow on all areas, for the femur, the tibia, the fibula, etc. And the actual muscles have a hard time catching up. And the reason being is because athletes are being athletes. They're running, they're jumping, they're squatting, they're doing all kinds of sort of things. And the muscles that surround the area, particularly right in the front, as you guys probably know, this is called your patella tendon. And it actually goes and inserts on the bottom portion right here of the tibia. And what ends up happening is the muscles become so tight that this area down here at the lower portion of the knee, where the patella is, matter of fact, you could probably reach down and feel, even on your own knee there's a little bump right there. And that is because the body has been laying down bone as fast as it can to try and catch up. So if your son or daughter is experiencing knee pain, but it's actually right below the knee down into here, chances are you're experiencing something called Osgood-Schlatter's disease. I made another video talking all about it, so you can go check that out. I'll link it below. But know this, it's not an instability issue in the knee. It's quote unquote growing pains or whatever you want to call it. But we'll talk a little bit more about care for it in a second. Now, the second one is what we call, and I'm right looking at these down over here, called patellar tendonitis. And if we bring the knee back up, what we're looking at is actually an inflammation just below the patella. So Osgood-Schlatter's is down here on the connection between the patella and the bone. And patellar tendonitis, or what is also known as jumper's knee, is just below the actual apex of the patella. So I'm going to take this, watch this, boom, there's the patella right there. And we're going to slide it right back on top there so you guys can kind of see the knee. And this is an inflammation of the actual patellar tendon. One way to kind of figure out the differentiation between patellar tendonitis and Osgood-Schlatter's is actually to palpate it or touch. Is it hurt here? Or if I take and I move the patella back and forth, does it hurt when I do that? And if your son or daughter is saying, yes, it hurts so much, chances are it's patellar tendonitis. And we see that a lot, as I said, it's called jumper's knee because a lot of our athletes get it from jumping, like jumping with basketball, or kids that play a lot of soccer where they're like making quick little movements with their feet and their knees are always bending in different directions, and that can cause some inflammation down there. So that is the second most common knee complaint. The third one is what they call patellofemoral syndrome. Now again, big word, let me break it down. Basically what it is it's the combination of the patella, like we talked about, that guy right there, and the femur, this guy right here, and it's actually a grinding sensation. I'm gonna try to get this in focus. It's a grinding sensation that happens when this guy goes back and forth over the top of it here. These patients will come in and say, Beau, my knee doesn't hurt necessarily when I jump, but every time I contract my quadriceps, oh my gosh, my knee feels like it's grinding in there. And then honestly, that's exactly what's happening. There's another condition called chondromalacia patella. That's not what this is, but this is literally just as it's so tight because it's being brought up and down. There's no movement in there from the muscles, and it's dragging right over the top and hitting the actual femur bone. All right, now here's the deal. What do you do about all of this stuff? And here's the cool part about it. With most of these, you actually will have the exact same treatment protocol, just like I said. So the first thing is this, is we need to decrease the inflammation that's happening in the actual knee joint. A lot of times people say just apply ice. And applying ice is a really good idea for 10 to 15 minutes at a time. However, what I find with my athletes, I use something called an ice cup massage. Now, you can get Dixie cups and fill them with water and freeze them and tear them off, or you can use this handy dandy little blue thing. I'll put a link below. And it's the same kind of idea. You fill it with water, you freeze it, you take the top off, and it leaves like a little bit, and you take it and you actually rub right over the area of where it's being affected at. And you do it for about 3 to 5 minutes. And it helps to drive ice and penetrate cold deep down within the tissue. A lot of times people ask me, Beau, can I use like a biofreeze or a Bengay? You can, however, that is very, very topical, meaning it's not gonna penetrate down deep into the tissues. And the best way to do that is through an actual ice cup massage. Second grade is direct ice with like an ice pack. Again, I'll link my favorite ones down below. And then thirdly, is full body submersion, like sitting like in an ice tub. So number one, you want to ice it down. Second thing that we need to do is we need to create balance between the muscles, between the quadriceps. Matter of fact, quadriceps meaning 4, because there's 4 muscles of your quadriceps. Makes sense, right? Now, one of the most common things that we see, I'm going to bring my knee back up here, is we see an imbalance happening between the muscles on the inside portion of the knee and the outside portion of the knee. And what ends up happening is the muscle on the inside, called your vastus medialis, and there's another one called vastus medialis oblique, which sits right below here. These muscles become very tight, and your patella literally is supposed to slide back and forth like this. But if the muscles become tight, what we see is the patella actually moves and slides over here. So instead of it sliding like this, it being moved back and forth, just like this with every motion. And what that ends up doing is it ends up causing a strain lower here in the patella, or if you're going through the puberty like we talked about with Osgood-Schlatter's, this will actually start to avulse and pull off the bone, causing an inflammation down there. Or we talked about if you're getting pain behind that kneecap right here and it's being pulled over, you'll start getting that patellofemoral syndrome, where it's literally, whoa, I'm losing that part of my big knee, being dragged along the base of the bone there. So the best thing for that, guys, is to stretch the quadriceps. But not only stretch the quadriceps, you have to physically get in there and kind of pin and stretch them. So for a lot of my athletes, I suggest that they get a massage gun, like a Hypervolt, or like some of the other ones I've reviewed here on this channel. Again, I'll put some links below. You guys can go in there. They're not expensive. At the very least, you need to foam roll over the quadriceps. All 4 quadriceps, really paying attention to vastus medialis and vastus lateralis. That's on the outside portion of the knee. Lastly, guys, you can do some bracing by using like a compression sleeve over the whole knee to try to keep the knee a little bit more stable so the muscles don't have to activate as more. Or you can use something called a CHOPAT brace, which is what you would use for Osgood-Schlatter's, which would sit over the actual patella to help decrease the amount of friction that's happening at the lower portion of the leg and the knee. All right, guys, I hope that helps to explain some stuff. I know every year in my practice, I probably see 50 to 75 of my younger athletes coming in with some sort of knee issue, especially when they get back to exercise or when we see a change of sport, when they go from like playing football to then playing basketball, or they go from playing basketball to then running track. And these are some of the most common issues that we see come through. You know, there's all types of different therapies that you can do in addition. I'm a huge believer in ultrasound and kinesiotaping and laser and chiropractic adjustments and etc. But for the sake of this small conversation, let's just kind of leave it to that. So we want to ice it, we want to stretch it, we want to massage it, and then we want to brace it if we need to on that aspect. All right, guys, I know you guys are going to have questions. Please ask below in the comments. I always try to jump in and help you guys out. Also, love so many of you guys here on my channel. Currently, right now, we just broke 10,000 subscribers. For me, that's a big thing. I think this is pretty cool. I think it's pretty amazing that I can sit in my office and just share some knowledge and help to create some influence on your life. And ultimately, that's what I want to do. I want to help as many athletes as I can via my channel, just like this. All right, guys, have an amazing day. Like I said, if you have questions, boom, ask them down in the comments and I'll jump in. Talk to you later. Bye.